Hello mga ka-nursing, welcome back to our channel. Again, this is Sir Joel Pascua and welcome to the last phase, okay, of the nursing process, which is your evaluation phase. For the evaluation phase, this is the last phase of the nursing process that we will be discussing today. Other discussions of the phases of the nursing process, such as your assessment, nursing diagnosis, your planning, and also your implementation phase are already posted in our YouTube channel. If you want to look for the link, kindly please check our description box for the link of those videos. But before we start with this video of evaluation phase, please don't forget to like, share, and comment this video. And of course, please subscribe to our channel para maging updated ka sa mga next nursing videos natin. Okay, for the evaluation phase, guys, let us define what is evaluation phase. According to the book of Kuzier, planned evaluation phase is the planned, ongoing, purposeful activity in which the client and healthcare professionals determine the following. Number one is the client's progress towards the achievement of the goals and outcomes and the effectiveness of the nursing care plan that we have created. Remember, during our previous phases po, especially in the planning phase, which is a product of deliberative critical thinking skills na ginawa natin based on the nursing diagnosis and the assessment data that we are able to collect. Okay, we were able to come up with the goals, and based on these goals or outcomes, we were able to come up or select the best nursing interventions to address or for us to achieve these goals. And the planning phase, that is during the planning phase. During the implementation phase, which is the phase prior to evaluation, we did implement all the interventions that we have planned. And during your evaluation phase, we are going to check, okay, if the goal that we have set we're able to achieve, and if the interventions that we have selected is effective in order for us to determine if we're able to achieve our goals and outcome. Okay, so that is what evaluation phase is about for. Now, for the process of evaluating the client's responses, we are going to discuss several components of the evaluation phase. Number one is that we have to collect data. So this is your reassessment. Okay, we have to reassess. Okay, reassess the client. Okay, reassess the client about the changes that had happened after we have provided the nursing intervention. And during the collection of data, okay, we are going to collect whatever data is related to the client's condition. Then after that, we are going to compare that with the data, okay, compare the data with the desired outcomes. Okay, the desired outcomes that we have selected or set during your planning phase. So during this time, we are going to check, for example, if during the assessment and during the planning phase, ang pasyente natin is high blood during assessment and we want, or hyperthermic or may lagnat or with fever, okay, and we want during the planning phase, we have set a goal that we want the temperature to be within the normal range. Okay, so during this second phase or second step under your evaluation phase, comparing the data with the desired outcome, we will check now the temperature, okay, that we have set as part of our goal or desired outcome during the planning phase, if it's the same, okay, or within the range, okay, during the evaluation phase. So i-assess na natin. So kung ang range na nilagay natin doon is 36 to 37.4, we will try to compare now the actual data we have collected during the evaluation phase if it's within that normal range that we have set during the outcome or desired outcome setting. Okay, so the same thing is true sa ating short term or long term. So iti-try natin to i-check during the evaluation phase based on the collected data or reassessed data if we were able to meet now your short term and long term goals. Okay, and letter C or number 3, the third steps is relating now these nursing activities to the outcomes. So is it something to do or is it because of the nursing interventions that we have provided? That's why na-achieve natin itong goal na ito or the outcome or the desired outcome, or is there any other factors that contributed, okay, doon sa development na nakita natin during the evaluation phase. Kasi during the evaluation phase, pwedeng sobrang taas ang nangyari or pumunta na sa normal range. Like for example, upon evaluation, okay, we will try to when you check your evaluation, okay, the temperature after nursing intervention goes up to tumaas pa rin. Okay, after ng iyong nursing intervention tumaas pa rin siya. So we will now try to relate this sa ating interventions. Tama kaya ang ginawa nating interventions? Or do we need to change something in our interventions? Kasi nga, obviously, hindi siya naging effective if we were not unable or if we are unable to achieve the goals that we have set. So that's relating nursing activities, okay, relating nursing activities into your outcomes or set outcomes. Okay? Now, the fourth phase or the fourth steps under your evaluation process is drawing conclusions about the problem status. Okay? Yun, drawing conclusions. So, when you try to relate now the activities that you perform, okay, then you will try to check based on the actual information or actual data that you have collected if you were able to successfully address the condition or not. So, if you're not, then based on that relationship, you will now going to draw your conclusions if it's met or unmet. So, tatlong conclusions ang pwede natin ilagay. Met, okay, if all the desired outcomes or criteria were met. Okay, partially met, kung parts of the data that we have or the desired outcomes that we have set were met but some are not, but if and not met, okay, not met if no, okay, no desired outcomes were changed or improved during the evaluation phase after you have performed the nursing interventions. So met po ang ating interpretation or conclusion kapag lahat ng desired outcomes natin ay na-achieve. Partially met kung may part na na-achieve pero may part na hindi. And not met pag hindi or wala ni isang na-met doon sa mga desired outcomes na isinet natin during the planning phase. Okay? Then after that, you will decide now to either continue what you have planned or since hindi siya met or partially met lang, considering your NCP to be modified or terminating the NCP because you already met everything. Okay? So, kung i-continue mo yan, for example, partial, you may continue kasi baka kulang pa yung oras, or you may wanna modify something kasi partially or not met siya, or i-terminate mo na yung inyong nursing care plan kasi nga you were able to meet the nursing outcomes that you have set during the planning phase. For us to better understand this, let's put it into example. Like for example, we have here a nursing diagnosis, ineffective airway clearance related to viscous secretions and shallow chest expansion secondary to fluid volume deficit, pain, and fatigue. Okay, now the goals or the desired outcomes that we have set is that after 8 hours of nursing procedures, the patient will be able to demonstrate effective gas exchange by, okay, or as evidenced by absence of pallor, use of correct breathing or coughing exercise, patient will have a productive cough, symmetric chest excursion at least 4 cm, clear lung sound during auscultation, respiration of 12 to 22 breaths per minute, and pulse less than 100, and inhales normal volume of air on an incentive spirometry. Now, during the evaluation phase, so i-implement po natin yan. After ng desired outcomes natin, planning, after ng planning, we are going to implement. So, implement all the nursing interventions that you have come up with or selected to address or for you to achieve, okay, achieve the following. Okay, for you to achieve the following. Then after that, you will go to your evaluation. How am I going to evaluate that? You have to first reassess. Check mo kung pale ba ang pasyente, check mo kung umuubo, check mo kung correct ang breathing exercise niya, check mo ang kanyang chest excursion, check mo ang lung expansion or lung sound, check mo ang kanyang respiration, and check mo ang kanyang incentive spirometry. Okay, so because these are the criteria, these are the desired outcome. Okay, these are the desired outcome. Like for example, so you are going to evaluate it and you're going to create now or relate this to your nursing interventions, then drawing a conclusions kung na-meet ba o hindi. So, kung na-meet mo ba hindi, for example, met siya, met if all of these, okay, desired outcomes were able to achieve after the interventions or during the evaluation phase. Okay, so all. Okay, for example, yes, hindi siya pale. Okay, rec ang breathing pattern exercise niya. There is productive cough, excursion, meron naman. Pero meron pa siyang hindi pa clear ang lung sounds, hindi pa clear ang respirations niya is more than 22 beats per minute, and cardiac rate is 103. Incentive spirometry is hindi pa ganun kataas ang normal volume na nai-inspire niya during incentive spirometry. Therefore, hindi lahat po na-achieve. So, itatag mo siya as partially. Okay? Partially met. Okay? Not all desired outcomes were met. Paano naman po, sir, kapag lahat po yan ay presence pa rin? Pale ang pasyente, hindi humihinga ng maayos, without or not coughing effectively. The patient's chest excursion is still not in good condition. Respiration is still above normal. Pulse rate is still above normal. Lung sound still has crackle sounds. And in terms of incentive spirometry, patient's incentive spirometry is not still within the normal range. It means to say that the patient, after the nursing care plan were implemented, still nothing changes in terms of the desired outcomes that we have set. So you're going to tag it or conclude it as not met. Okay? No achieve. Okay, no achieve desired outcome. Wala kang na-achieve na desired outcome. So, pag lahat na-achieve mo, met, some are not met, or some were able to achieve, and some desired outcome were not able to achieve, partially met, and not met naman po kapag walang na-achieve na desired outcome. Okay? Sana po maliwanag sa atin yan. And that is an example on how are you going to evaluate now your nursing care plan. Okay? After you have implemented the nursing intervention. And the last phase doon sa ating evaluation process is that you will going to decide if you are going to continue, okay, or modify at least your nursing care plan, or you're going to terminate the nursing care plan because you were able to meet all the desired outcomes that you want to achieve during the nursing care plan process. Okay, so that is your evaluation phase. Okay, aside from this concept about your evaluation phase, we also need to discuss these important concepts about evaluation, okay, which is your evaluating quality of nursing care. Whenever we provide nursing interventions to the patients, okay, institutions actually try to check if the care that we are providing to our patients are effective, okay, and they will be able to come up with different policies and guidelines that we need to follow per institution. Now, in evaluation, okay, we have to know what is quality assurance. So, in every institution, chine-check yung mga activities natin, chine-check yung mga ginagawa natin, if we are really doing the right thing. And when we talk about quality assurance, we are following guidelines, okay, a policy that was set by the institution and that is needed to follow whenever we are going to perform a certain task in the institutions where we are working with. Now, quality assurance is an ongoing systematic process that is designed to evaluate and promote excellence in the healthcare provided to clients. Earlier in the first part of our discussion, we did an evaluation as part of the nursing process, which is included in the nursing process, and we were able to perform evaluation by evaluating our nursing care plan. Itong quality assurance naman is another evaluation wherein this evaluation pertains now to the evaluation or set of criteria set by the institutions to check if we are providing a quality and excellent care to our clientele. Okay? The evaluation of the level of care provided in the healthcare agencies where we are working with. Okay? The components of quality assurance includes the following. Number one is the structural evaluation, your process evaluation, and your outcome evaluation. Okay, in some books, okay, especially in community, we call this as your elements, the elements of quality assurance. So whenever we are going to perform a quality assurance check, okay, or you're evaluating a certain facility, okay, we need to consider these three components. Number one is structure. When we discuss structure, we are referring to evaluation of the facility. Okay, evaluation of the facility itself, its completeness in terms of its supplies, okay, in terms of supplies, and in terms of its equipment, okay. So basically, if we are referring to the structure evaluation, we are referring to the evaluating the actual facility itself, the institution, okay, the supplies na meron, okay, the logistics, and of course, the equipment that the facility has. So kapag in-evaluate natin ang equipment effectiveness, nyari, check natin kung gumagana ba ang mga equipment, kumpleto ba ang mga gamot, kumpleto ba ang mga gloves, kumpleto ba ang mga gamit, yung facility natin, kumpleto ba, meron bang X-ray, meron ba tayong X-ray facility, kamusta yung ER, kamusta yung structure mismo ng building, okay? So those are referring to the components of quality assurance as structure evaluation. Pag process evaluation naman, we are assessing or we are evaluating the method, okay? We are evaluating the method that the institution is using. Like for example, yung policy, okay? We have to check the policy. We have to check the nursing process. The nursing process, and basically we are assessing the nurses. Okay? The nurses. Kung i-check naman natin yung policy that is designed for doctors, then we have to check yung policy kung paano ginagawa ng mga doctors yung indicated policy for them. And we call that as process evaluation. Kadalasan ito po yung tinitignan ng mga accreditors like your ISO. Okay, yung mga accreditors like ISO for nursing schools or private schools, or for private institutions who are offering education, like your PACOCOA. Okay, yung PACOCOA natin, yan din po yung chine-check nila. Okay, the process on how do we make things in our institution. And the last one is the outcome evaluation or your output. Okay? Sa atin, sa hospital, we are assessing the patient. Okay? Kamusta yung experience ng pasyente? Natuwa ba siya o hindi? Kapag nasa hospital ka, like for example, if you were working in hospital, ito yung mga CSAT form. Okay? Customer Satisfaction Form na pinapasagot natin sa mga pasyente bago sila ma-discharge. Okay? Yun yung mga ginagamit natin to check now the outcome evaluation as one of the components of your quality assurance. Ano pa? Outcome evaluation. Pag sa school, kamusta yung ating mga alumnus? Okay? Mga alumni natin. Kamusta yung mga ating mga alumni? Are they paying back? Okay? Nagvi-visit ba sila? They were either active member of the alumni organization. Kamusta? Saan sila nagtatrabaho? Or yung graduates ba natin is employed? Kung employed sila, is it considered underemployed or employed talaga, like within their career? Are they practicing their career? So those are your outcome evaluation, referring now to the patient or to the products, okay, or the effects of the actions that we have created. Okay, again, structure referring now to the facility, including its supplies and equipments. Process includes now the method that we use, including the policy. Sa mga nurses is the nursing process na ginagawa. And commonly, ito yung mga tinitignan ng accreditors such as your ISO. And outcome evaluation, kamusta naman po yung ating mga product, okay, sa hospital. So we give the CSAT, okay, to our patient, para malaman kung satisfied ba sila sa services natin. Same thing din sa mga tao when they visit the schools or if you are working in a certain facility. Okay, that is the components of quality assurance or the elements of evaluation. in some books. Kinatawag sa in some books. Okay? Now, still under your evaluating quality nursing care, we have to know yung tinatawag na quality improvement. So, ito naman yung gagawin natin after the evaluation. Okay? These are combined and unceasing efforts of everybody in a company to make everything about it, especially its production process, better. Okay, so after the evaluation, so we have to ask ourselves, what went wrong? Bakit hindi natin nakuha yung highest score? And we will ask again ourselves, what are the things we need to do in order to improve it? Yan na yung quality improvement. So this is the systematic approach now to the elimination or reduction of rework, waste, and losses in the production process. That is your quality improvement. We also do this, okay, sa mga schools and also in the hospital. Whatever they think is not good practice, kailangan i-improve. Okay? And still under your nursing, quality nursing care, okay, meron tayong tinatawag na nursing audit. Nursing audit is can either be retrospective, okay, or concurrent. Retrospective is the evaluation of the client's record after discharge from the agency, and concurrent audit is the evaluation of client's healthcare while the client is still receiving care from the agency. Therefore, this is your um, past, okay, mostly past, and this is your present, okay, while the patient is still in the hospital care or in the care of the patient. And with our next video that I'll be uploading soon, we will try to create now your NCP, okay, using now this format, this basic format that we have, which is your assessment, nursing diagnosis, planning, intervention implementation, then your evaluation. Okay, so we will try to create a nursing care plan that would really help, especially the students during their case studies, okay, after their rotational duties. So, i-discuss po natin at pakiabangan po yung video natin with regards to the creation of your NCP. I will try to at least walk you through from the process on how to create now your nursing on how to create now your NCP using now the different materials that we have such as your Nanda. Okay? So please pakiabangan po yung video natin about it. Okay? But for now, we are going to end this video here. Okay? And I hope you have learned something. If you did, don't forget to please like, okay, this video, comment, share this video to your nursing friends, nursing student friends, kahit sang school man kayo. And of course, please do subscribe to our channel. And thank you everyone to our subscribers. Kasi nga, we're able to achieve already 1,000 subscribers just the other day. So thank you for your support. And I'm looking forward to be working with all of you. And I hope that you are learning with the videos that I am uploading. So again, this is Sir Joel Nyo. And thank you to future nurses. Bye for now.